Hi folks, welcome back to the channel. My name is Drew. I'm an exercise physiologist and Chinese medicine practitioner, and I kind of specialize in exercise rehabilitation using both classical movement therapy, Qigong, Tai Chi, yoga, pranayama, and combining that with our modern understanding in exercise rehabilitation and science. So when we're doing things like yoga therapy, which is where you use classical yoga practices to help people recover from accident, illness, and injury, yoga asana is a big component of that. So to understand yoga asana, we, like all kind of movement practices, you need to kind of get a good feel of what's going on in the body, what muscles are doing what the joints are doing. And in this series, we're looking really at kind of the biomechanics of yoga postures. And you could take elbow plank, for example, what we're doing today, and you could put that in a Pilates class. It's the same movement. You could put it in a gym class. It's the same movement. You could put in a physiotherapy rehab program. It's the same movement. It's all the same. It's just because the anatomy is the same. It doesn't matter what you're doing. So when you look at the kind of broad principles, it's the same. Where yoga is different is they apply a lot of lifestyle intervention. They really focus a lot with the breath. They have specific postures to facilitate nervous system regulation, particularly, and there's a lot of kind of mindfulness within the posture as well. So it's a way of preparing the body for pranayama, and then pranayama prepares the body for meditation, and then meditation prepares you to kind of self-realization in a sense. So the yogas are like a really holistic approach to health and well-being, versus like a gym program where you really the gym program is really about the kind of the physicality of the gym and also the mental resilience as well. So there's definitely combined there. But like the psychology component is generally separated out. But here in yoga, it's all built into it, which is pretty cool. But anyway, we're going to be focusing on the actual physicality, the function of the posture. We're using yoga muscle in motion. We're on the yoga app. So you've got strength training app, posture app, and the anatomy app. And we're in asana. We're in core asanas, and you'll find elbow plank in core asana. So if we maximize it up here. So we can see here that elbow plank, the muscles in red are the ones that are contracting. So they're the primary movement muscles. So the key areas you want to focus on is the quadriceps and hip flexors. So rectus femoris here. Then you've got hip flexors coming up deep into the spine, iliopsoas. You've got the rectus abdominis, or the abdominal wall, transverse abdominis, pelvic floor muscles, spinal stabilizers, serratus anterior, and cervical extensors. So a plank is typically considered to be a fairly full body movement because you have to use your legs, your hips, your core, and your scapulothoracic muscles all in conjunction, and then you have to be able to breathe doing that. So, and if we look at this lady here doing a demonstration, excellent demonstration here. Elbows are directly underneath the shoulder joint. So elbows underneath the shoulder. So you want the humerus almost vertical. Okay. Palms are flat. Eye gaze looking just in front of the fingertips. Slight retraction of the head or a chin tuck. So the cervical extensors are long. Abdominal brace is engaged. Slight pelvic tilt. Okay, good. To contract the glutes. What's not shown here is the glute contraction, which I think is a bit of an omission. We'll talk about that in a bit. You can see the quadriceps are contracting quite strongly, and you're going to get a toe stretch through here. The plantar fascia will get stretched because the toes are holding you up. You could easily convert this into a knee plank, so just bringing the knees down so the line will be slightly different through here, but you can easily do that. So let's break this one down a little bit more detail. So this is a really good app. As usual, we're only going to be showing you some of the kind of aspects of this app. So I want to encourage you to go and buy it and support the company who makes it. I'm not getting any kickbacks. I'm not affiliated with them at all, but it's just a great app to learn tool with. So we go to number 2. This is really great. This is one of the most overlooked aspects of doing planks and push-ups, is this scapular protraction via the serratus anterior. So the reason you want to be able to do this is that this muscle here, the serratus anterior, is as big as your pec major, the chest muscle, and it attaches along the kind of medial border of the shoulder blade. And so when you're in plank, what you want to do is push your arms into the floor or your elbows into the floor if you're in plank. Okay, that contracts this muscle and it pulls the shoulder blade down, and you get what's called a shoulder blade spread here, or the scapula go into abduction. So they move apart. This provides a really, really strong, stable torso, and it's really encourages you to use the muscles that stabilize the upper body particularly. So you want to be able to get into this position here. So press, get that shoulder blade spread, get those serratus anterior muscles on. What will happen if you don't do this is, so if we come back to, we'll recycle through, if we pause here, if you try to do your plank here, which you can do, what happens is, because this muscle is not fully contracted, you'll typically use your upper trapezius muscles a lot. And so you'll get into a shrug kind of shape. And that puts a lot of strain and pressure onto the neck and the base of the head as well. And it's just not comfortable. And then it also doesn't allow you to kind of access your triceps and your deltoids very well, just because of the position you'll wind up in. So you want to get into this protracted scapular position. Now, there's kind of two levels to it. There's a level where you kind of get into a nice neutral kind of curve. So the neutral curves of the spine stay relatively the same. Or you can go up into what's called more of a hold out position, where you really press it and push up as far as you can. And you'll get a more of a rounded kyphotic type posture, which is what you want. And it's very, very strong position to be in. Okay, so you'll see that in a lot of like gymnastics, kind of calisthenics moves. I'll press up into what's called a hold out plank position. So depending on your goal and what movement you're trying to perform, if you go into that fully pressed out position, the joints will be fully closed down, meaning like they'll come into full flexion, and so then they can't rotate. So it's a really, really strong position if you're only moving in one direction, forward and back, or up and down. But if you need to do some kind of twist or rotation, you may not want to go up into that full rotation. So you just need to come off a little bit. So just some subtle variation there. So a really, really important aspect of the plank. It doesn't matter if it's on your knees, elbows, or straight arm in this position. Let's have a look at the next one. So here we're looking at some of the muscles. Get me out of the way. Pause there. Okay, so come back. So everyone does planks for their core, right? So the core is really four core muscles, or core muscles. So you've got rectus abdominis, which is the six-pack muscle, but it's not labeled very well. It should be like 1, 2, 3, 4. So there's really 8 sections into that muscle. So it's usually 8-pack, but you don't really see the flat one there, unless you've got super low body fat. So you got rectus abdominis, and here we're showing transverse abdominis, which, notice the horizontal lines. This becomes important when you're doing bracing. So when you contract the rectus abdominis, it pulls the ribs down this way, or pulls the big bone up this way. And that typically creates flexion of the spine, so a slight rounding, which is also represented in pelvic tilting. So if you're using the lower fibers of your abdominals here to pulling up onto the big bone, you're going to create a posterior pelvic tilt as well. So rectus abdominis works very closely with the glute medius, which we'll talk about in a minute. Then we have the transverse abdominis, which have more horizontal fibers. And so when they contract, they're going to compress inwards a little bit. And so it pushes all the abdominal contents into the spine. So you have what's called intra-abdominal pressure, IAP. So as you brace, you contract a muscle, and it's just a squeezing sensation, like a tensing sensation. You don't need to like suck in, you just tense it. And that provides stability. It kind of stiffens the spine. That works really well on the inhale. Now, when you're doing a lot more advanced kind of exercise, so like in high-level Pilates movements, what you learn to do is kind of keep this TVA engaged both on inhalation and exhalation, because the ribs will still be able to move in and out with that TVA engaged. And so you have stabilization right through the movement. It's a bit more of advanced kind of practice, takes a bit more to get you wrap your head around. So core muscles there. Then we go into the back muscles. So we have all our kind of spinal muscles. So here we're shown in multifidi. Then you've got the rotatories. Then you're going to have ilicostalis, erector spinae, muscles threading right at the back. So the erector spinae muscles, they will be contracting to stabilize the spine against gravity. So they will definitely be working. You'll have your QR muscle here. That'll be working as well. There we have the serratus anterior pushing down. And here we have the pelvic floor as a group. Now, one way to look at the pelvic floor, there's lots of different pelvic floor muscles through here. But the fiber direction is coming across. Okay, so if you visualize your sit bones, your pubic bones here, not your pubic bones, your ischial tuberosities. Okay, and as you exhale, if you think about contracting your perineum and then drawing the bones toward each other, that will create a pelvic floor stability, stabilization. So that typically does on the exhale. So as you breathe out, squeeze and draw in. Now, what you want to do is focus on kind of like pulling the two bones together and tensing those muscles. Okay. And often, I don't know why people do it, but instead of like sucking up into your pelvis, you don't want to do that because the muscles don't actually suck up, they just draw across. Now, because they're in a slight dome shape, as they draw together, they will flatten. And that gives you that sensation of the lifting. But you don't need to like focus on lifting, you just need to draw it in, and then it'll just naturally kind of lift up. So this is an upside down dome, right? So that'll lift up. But you also have another layer of muscles that go from basically the sacrum coccyx to the front of the pubic bone, and they're going in this direction. And they do the same thing as well. So you're going to get like side to side, front to back, and that's kind of the pelvic bowl. This diaphragm here, this pelvic diaphragm, works with the respiratory diaphragm. So when you inhale, the diaphragm's pushing downward. Okay, so then this pushes all the stomach contents downwards, the bladder downwards, and this downward motion. So what happens here is that these muscles eccentrically lengthen. So they lengthen as you inhale and create a bit of space. So typically the inhalation is where you're going to get the pelvic floor has like an opening or relaxing type of feeling, but it's generally kind of eccentrically lengthening. Okay. And then on the exhale, it reverses. So as you breathe out, the diaphragm domes back up and the pelvic floor contracts and stabilizes at the bottom. So in yoga, we do what's called breast-centered asana. So when you're inhaling and exhaling, you're moving with the inhale and the exhale on purpose. And that really facilitates a really functional, healthy spinal movement, pelvic floor movement. And you essentially resolve a lot of kind of biomechanical issues when you just really practice kind of breast-centered movement. It's really, really good. So particularly the way I teach yoga is breast-centered. So if people come to my class, I've got one on the YouTube channel. It's more of a Pilates class, but it's the same thing. You'll always be cueing inhale and exhaling with the movement. And in yoga, they spend a lot of time doing that. So like in a forward fold, if you forward fold to touch your toes, that's an exhalation movement. But if you lift your chest up to stand up, that's an inhalation movement. And that follows the natural mechanics of the spine and the pelvis. Here we're just showing you the kind of plantar fascia stretch you're going to get because you're going to bend your toes. And here, that's another angle of the pelvic floor. You can see those kind of fibers coming from the pubis here on the front to the coccyx sacrum there. And then we've got the sit bone here, the ischial tuberosities here. That's where the hamstrings attach there. So that kind of creates that nice pelvic kind of bowl of pelvic diaphragm, which is really, really key, particularly if you've had any kind of like SIJ, pelvic issues in the past. Great for women who are recovering post-pregnancy to really kind of help reconnect to the pelvic bowl. This is a nice little kind of demonstration of alignment. So here we have 3 key kind of like alignment cues to focus on. So if you get like a dowel or a stick and you put a stick on sacrum, and then kind of in that kind of mid-thoracic region around about T6, T7, and then at the base of the head on the occipital region there. And if you get the natural lordosis of the neck and the lateral lordosis of the lumbar spine, and you keep those 3 points connected to the stick, all right, that basically will maintain good spinal alignment. So when we're kind of teaching people movement and then they don't really have a lot of kind of body awareness, they don't know how to organize their spine properly, a stick or a dowel can be a really good kind of way of helping them connect to where they need to put the head, where they need to put the shoulders, etc., to find that nice neutral position. Now, if we were to do that hollowed out plank where you press in the elbows, get more thoracic anterior contraction, so the shoulder blade pushes up, you only get a fully rounded kind of kyphotic posture here, and then this won't work because you're not going to be able to maintain that shape because you've moved out of that alignment. So just keep that in mind as well. So this is good for beginners. The hollowed out plank position is more advanced for people who are doing more advanced work, because you need to know what you're doing, when to go into it, when to come out to it, how to come in and out of that posture. Let's look at the next one. 4. So we just got another little demonstration here of the contraction of the abdominals. Okay. Something to keep in mind too, this is an anti-gravity position. So gravity is going to be pushing down this way. So that's going to facilitate you to kind of arch your lower back a little bit. So from underneath, the abdominals are contracting to kind of prevent that arching to occur, which when we have a look in common problems, so if we go to, this is a great video. I love this video. So this is the common thing you'll see in a lot of people's plank. Doesn't matter if it's on the elbow or if it's on the straight arm position. They're going to get into too much and lordosis, or the back arch, or the back sag. And that's because either like they're fatiguing out, they're not using your abdominals properly, or the hip flexors are way too tight. So if your hip flexors are really tight, so your rectus femoris here and your psoas, which is not shown, they attach onto the lumbar vertebrae here, and if they're tight, they're going to be pulling you down into a lordosis, into an anterior tilt. So that's going to create this rotation of the pelvis this way. Okay. Because your gravity is coming down this way, that means a lot of the loading is going to go into this region through here, which can kind of compromise or compress the disc, compress the joints, and then just be really uncomfortable. It'll also throw out the kind of alignment of the upper back and the neck and shoulders. And so it's just really not a good scene to do, to hang out in here, particularly if people aren't engaging their lumbar spine or their glutes. They're just resting on the joints. That's the thing you don't want to do. So you can kind of like be strong in the shoulders and kind of like keep your legs off the ground with your quads, and then just sag in here, and you're just resting on the joints. Now that can be a passive exercise if done well. But typically in plank, people are fatiguing out and they're not realizing they're doing that, and you're just going to stress the joints out. So what you want to be able to do is reverse that curve into more neutral. Yeah. So you want to posteriorly tilt your pelvis, which is glutes. Okay. And then at the same time, contract your abdominals, your rectus abdominis. So rectus abdominis is going to pull this way. Glute medius is going to contract and create a rotation this way, because the glute medius is contracting, is attaching this region here, and it comes down onto the front there. So as you lift up and you change the angle as this muscle is contracting, it's going to create a rotation this way. So glute med and then glute max attaches onto the back of the femur here as well. So when you add those two together, they kind of create this posterior tilt. And then you add in the rectus abdominis, and that kind of creates the rotation that way as well. And then that lifts the whole body up, and then you're very strong in that position. So not cool, strong, not cool, strong. Then if you add in that kind of thoracic anterior, press down into the elbows, get that shoulder blade spread, long neck, tuck your chin so your cervical extensors are engaged. So you're holding the weight of the head, engage your quads, you're good to go. You're in a nice strong plank position. Okay. So let's go to, just to show you straight arm plank. So everything is pretty much the same. Let's go back a little bit. The only difference in the straight arm plank to the elbow plank is that you're literally on your elbows. The elbows give you a bit more of support, so you can make it like a triangle, or you've got the whole forearm to rest your weight onto. But essentially the torso component is exactly the same. So you can see you've got a nice long neck, chin is slightly tucked, or chin is in retraction. So you tuck your chin in and retract your chin. You can see your neck muscles here engaged. This big one here is going to be your sternocleidomastoid, which is when you tuck your chin in, it puts that in a long position. So you want this long and strong, which is great. You want that cervical extensor going to be on. You can see here, just with the kind of a hollow in the shirt, that she's not fully protracted yet. So, but that's okay because she's maintaining a nice line. So you got ankle, knee, hip, shoulder, ear in this kind of nice line. So that's pretty good. If you want to go into that hollow out position, what you do is you cue to press down into the palms and push your middle back up towards the roof. And you get that more of that shoulder spread. So that'll be a strong position, depending on which version you want to do. You can see abdominal muscles here contracting. You can see the glute muscles here are contracting. Quads are on, nice and strong. And you're going to get some kind of anterior shin stuff here as well, which is pretty cool. So overall, a great kind of demonstration of plank position. Just keeping in mind, if you want to go into a hold out plank, it'll be more of an arch kyphotic position and more of a posterior pelvic tilt. And that'll give you a stronger abdominal contraction as well. So just something to keep in mind there. All right, guys. So thank you for hanging around and going through the plank. Some various kind of anatomical cues and tips for you guys. Hope you enjoyed it. If you have any questions, feel free to drop a comment down in the comments below. Love if you could give me a like and a share to keep growing the channel, and look forward to catching up to you in the next